I'm a nurse in Sturgeon Lake First Nation. I've been here for the past 20 years and been a nurse over 30 years. So I come from a very diverse nursing background. I'm a Cree from Big River First Nation, and I work for a Cree community and called Sturgeon Lake. So the work that I've been doing for the past, for the past 30 years or so is working for our people. And I've worked in the hospital, had the privilege of working there. But my calling has always been to go back to work for our people in our communities, in First Nations community. So the community that I work for is a very very active community, culturally grounded, and really grounding their cultural programming and still practice their traditions. So my passion actually has been is revitalizing our traditional knowledge with our service delivery model that we currently are working with our community leadership and our elders. And when I first started in Sturgeon Lake, have actually been always aspired to have our traditional knowledge be grounded. And because we follow the Western systems, health systems, and for us, it's First Nations Inuit Health Branch who funds us, and under the envelope of overarching Health Canada. And so we follow the biomedical model. And to me, that has not been really meeting our needs, because it's been always missing the traditional, the holistic model, our cultural, our customs, everything that who we are has always been not acknowledged, I guess. And so we've been far removed, and we've always been looking at the biomedical model, which is a disease model, disease focused. And so for our past 20 years here, we've been building a model that has been supported by the leadership. And you can't move your programming without the support of the community and also the leadership. So before I wanted to acknowledge the community that I work for, Sturgeon Lake First Nation, and the leadership and the elders in my community. I also want to acknowledge my first teachers, which is my mom and dad, who have since passed on. And currently, I want to acknowledge my teachers, my traditional knowledge keepers, healers that have had the privilege of working under and apprenticing under. And so to me, this knowledge has been a lifelong learning experience, and I continue to work under that, under the guidance of our knowledge systems. And I wanted to I usually say that the work that I do is also guidance from I want to give thanks to our Creator today for a beautiful day. I want to shake hands to every one of you that are in this call and this work that we are going to be doing, that I want to acknowledge you, the participants who have dedicated your life to better yourselves and being inspired to follow your vision. And so my vision for when I took this role of the healing arts started, I guess, when I started my nursing career over 30 years, and my calling was in the healing field. And I come from a long line of medicine people as well. My ancestors had fund holders of the Sundance and the Sweat Lodge. 7 generations ago, I have ancestral lineage with Nakota, Stoney, and Ojibwe from my maternal side. And it runs on my blood memory that this is a calling that is very much evident. That so wonder that I have chosen this field. So at first I wanted to acknowledge where I come from, and so I'm a Cree with many ancestral lineage. So, and I also want to acknowledge every one of you and the work that you do. So, the community that I work for it's about 36,000 total population, and on reserve is 1,800 on reserve. We have a diverse population, and the community has really been working in the past over 20 years to revitalize their cultural, the language, and the community as a sovereign nation. They have, back in 1995, they had chosen to transfer their health services where it was once managed or delivered by Health Canada, and where they in turn were the ones hiring their nurses. And at that time, they had one nurse to service the whole community. And so when the community chose to transfer the health services and wanted to govern themselves, they had to do a lot of the prep work and how the proposal driven, everything that is done, you have to prepare. And so they made that negotiations with Health Canada to transfer their health services. And they had a vision of delivering their own services based on the needs of the community. So that's what health transfer means for us. So for me, that really was an important step of self-determination, self-sovereign nation, taking their right to self-govern their health services. And so we've been building from having one nurse to having to hire our own people and our own staff. And at that time, they had one or two community health representatives, and that was back in 1995. So since then, it has grown. So we have 7 nurses now. We have a total of, I would say, about 38 staff now. And so that to me is a very instrumental of self-governing. And that really provided the opportunity for the community to design a health model that is going to be responsive. And so we've been building more of a holistic model all these years, and a holistic model where our people can have access to, whether they chose to continue to access the Western model with a doctor having access to the other health services, but also access to the traditional side of things, access to a traditional healer, elder services, access to traditional medicines and all that. And so that to me was an important step. So we are working through a model called holistic model, and looking at the wellness model versus a disease model. There is something that that says that based on our elders' teachings, the oral history, that you need to have a vision for wellness. And one of the things that the wellness model does is that it talks about the envisioning a wellness for yourself, and And that's something that to me speaks really, really so much because one of the things that I remember growing up with my grandfather who taught me in life that, you know, if you want something in life, you have to work hard. You have to put that vision in and then he spoke in Cree. When he said this, he said, you know, no sim he's been like in doiting, and to me he said that in Cree. And he said that if you want something in life, you have to work hard for it. And you have to put that in front of you. And one of my other mentors who I was being mentored by is Don Coyas from the Well Variety Society there. He said that he talked about the four main principles of natural laws of change. And those four main principles of change, he said that you have to have a vision. In order for change to happen, you have to have a vision. So if you have wellness in front of you, you need to put that out. So number one is to have a vision for yourself. Number two is you need to become like that, what you think about. And when you have that in front of you, you start to move towards that. And you have to also there has to be great knowledge, great learning that has to happen. So that's the third one. And this is where all of you are seeking that knowledge to better yourself. And so that's the third principle. And the great learning has to happen. And that's what we do every day, is to better ourselves. And so the fourth principle is that you have to create a healthy forest. And so that's what we've been doing all these years. It's creating a healthy forest of people that are like-minded and wanting to have a vision for our wellness in our community. We created that within our community and creating opportunities for our people that are wanting for wellness, because we cannot do things for anybody. And we that's one thing about natural laws, is that you can't interfere in anybody's progress to self learning. They have to be the ones to attain that. And so that's the same concept. So with the Western models that they have these teachings. So the non-interference is very critical. So a lot of these teachings have always been the value systems, the customs that our people live by to this day. We may not, read about it. We may not hear about it, and we're not see it, but our people live through that. They role model those customs, those ways of being, and that's how rich our communities are. Like, we have very valuable resources that still exist, and those are very evident, and that's our structure. Our community has a holistic model that we look at, and when we're integrating both of these two models, the Western and the traditional pieces, the traditional side of things, and when you put those side to side, those are the two systems that exist in our communities. And we need to also understand that there is a middle ground there, where we say that this is where we want to harmonize our lives, because the fact is we can't go back to living in a teepees and all that, but we can go back to the value systems of our people. And those for us is the most important aspects of reconciling. We have to reconcile that traditional knowledge that exists within our knowledge systems in our communities. And we have very gifted people. We have very gifted youth. We have beautiful people that are artists, and they have so many gifts and healers that are coming on, that are awakening right now. And so we need to monopolize that. And one of the biggest things that I really love about this community is because they value our people and they want to employ our people. We create opportunities for our people to be employed, and that's something that we want to. And that's something that I know, have worked in the healthcare system, when working in the hospital. It is really important to see our people in that workforce, because having somebody care for you that is brown face, it brings a sense of peace and good feeling when your people are being looked after by their people. And so these are some things that I've come to understand, that you bring that essence of your identity, of your language. And I speak my language a lot of times, and so this is something that I feel passionate about. And so for our community to revitalize even the language, reawakening the arts of our language, our ways of being, and our ways of who we are as Indigenous people, our First Nations people. And then one of the biggest things that society doesn't really do well in the health field is looking after the spiritual side of our people, and also the emotional side of our people. And I know that the system that I've worked under for many years, that's one thing that they don't do well. And that's something our community is targeting, um, uh, providing spiritual well-being, emotional well-being, mobilizing all the people that exist, the services that exist, and with the guidance of our elders, our knowledge keepers. We've had a privilege of working alongside with some of our key doctors as well, uh, research colleagues that have been instrumental in working with us and to affect change. And because research also is something that our people have not been given an opportunity to use as a vehicle to affect change. So I had something that we're changing that. And we need to stop. And I think that's something that we, as a nation, that it's not okay anymore for researchers to come in our community to do pilot research, where they helicopter research, it's called. They just come and then they take, and we don't get benefits from that. So we're shifting that, and we're participating in one of those participatory health research, which is something that has been proven well with us. And the community has also taken ownership in establishing their own ethical research guidelines, because we as a nation also have every right to say when and how to do research and with. It's no longer for them to come and study us. It's us. We have to take that every right to do the research of our own research, what's going to work. And so there's been a lot of work that has been done in our community, and we have we had an opportunity to go speak on our behalf and tell our story. And to us, oral history is, to this day, has always been so vital, and it's been oral traditions many years ago, many generations have. That's how our people relayed the stories, and that's our history, is through sharing, storytelling, learning about the creation story. And this is how, like, when we talk about those systems, now I'm going to talk about our system. Like, I know the biomedical model, the Western system, is they have their own systems there already that are grounded already. The universities have their way of teaching, but we're talking about, what I want to talk to you about is the traditional side of our traditional programming, traditional health programming, our holistic programming. And when we started to harmonize both approaches that work in our community, our first step was the community established a elders advisory council, and alongside with the health board, and all of them also have to, when I talked about great learning that need to happen, like all of those systems have to be also going into the same learning as well. So I guess you'd say we've been in a great learning in the last 20 years, and finding our grounding and our knowledge keepers, revisiting our who we are as Cree people, what are our customs, and we looked at ourselves, and we looked at our creation story. We looked at our language, and we wanted to also look at how are we going to impact change in our community. And one of the things that really was struggling for me when I first started in our community was that, we saw so many of these, challenges, life challenges, the dysfunctional stuff, like every reserve has those. Like we have issues with addictions. We have issues of younger generation losing their culture. The language was starting to die off. And so it was a really big challenge, a great distress when I first started there, where like everybody wanted to, hang on to the culture. And so when I was talking to one of my knowledge keepers who has since passed on, his name was Alan Jacobs, and as troubling as I said, I don't know how I can impact in this community. Like there's so many things that is happening, and I don't know if I can make an impact. And one of the things that he really inspired me was that he said, don't worry about the adults. Focus on the children, and focus on the elders. Because the elders are the future wisdom keepers in our current wisdom keepers, and they're the ones that are still have that ancestral knowledge, that's still rich with that ancestral knowledge, and also the focusing on our youth and the children, and that's, you're going to affect change in the next 7 generations when you focus and bringing wellness to those core. Because he said, that young kid, when you teach that young child how to be about our culture, about our language, of the ways of our people, that young kid is going to ask his parents when they go home, what about this? What about this, Mom? What about this? That's what he said. And that is very true, because, these young kids that come home and go home to their parents, and they start asking their questions to their parents. And I say that because I see my notions, because I have 6 grandchildren, and already I see those minds being molded, and they're even you teach them, they're asking their parents about all those questions. And so that was really holds true what he said. And so when he said that really is what we've been building, focusing on our youth and our young people and our children, and creating opportunities for elder people to knowledge keepers or kihteak from our line. We create opportunities for them so they can, our ways, I was told, is that our old people don't belong in the nursing homes. And that's what we find. So we're trying to shift that now, because our grandmothers and grandfathers are the ones that are the instillers of our generational knowledge keeper stories, the teachings of ways of being, the ceremonies, the bundle keepers. So we build that, and that's building competency. Cultural competency also needs to be given an opportunity for our knowledge systems to have those opportunities as well. Because all of that great learning has to happen in all those stages of life, right? So that's building that holistic care model. So everything that we've come to understand from what I've been told is that life is a circle. We're infinite, life is infinite, and nothing in life is linear. And that's the opposite of the Western model. And for us, that there's 4 seasons of change. All of the seasons come, just as I know that there's all of the teachings that are out there. The medicine wheel teachings speak about those circular teachings. So that's the model that we also utilize with our teachings and land-based teachings. And so the greatest, like I said, is the greatest asset that we have is our people in our community. We need to create opportunities for that. And we, as a nation that is rising up, there has to be opportunities, economic opportunities. Now I see more our native arts, native designs, native craft, beading has really evolved, and this is where your mind is at right now. You're creating things, economic development. You're the leaders of our future generations, and so our people are the greatest resources that we have right now. Like, I've never seen so many people developing their own businesses as we see now, and more of the programs, wellness, miwayawin, healing methods being utilized now. More of our people are rising up, and so it's timely that our people share that platform. And so I'm in the health business, so I do a lot of teachings as well. I also I've been learning about the medicines all my life. So we do medicine teachings, we do medicine camps, medicine harvesting, all of those. Those are some of my passions in life. And our focus is wellness and strength-based, and also providing land-based opportunities and experiences. And so I work with a lot of like I said, we're mobilizing a lot of teams in our community. We work with the school, we work with the social workers, we work with the doctors in our community, the band staff, the youth, creating the youth opportunities for them to be part of the solutions. So for traditional health, we're grounding our traditional health first, and we feel that our culture has to be grounded first. It has to be rooted first with our traditional value systems rooted first. When I'm speaking of the traditional value system, I'm talking about our value systems, about who we are as Indigenous people. So our teachings that speak about the ways of the sacred pipe, our connection with Mother Earth, our Mamanawaski, our connection with everything that is around the forest, our traditional oral histories, the histories of the stories of who you are, your lineage, your language, our ceremonies. We're very much involved with the Sundances here in our territory, the sweat lodge, the medicines, the traditional healing, our Indian governance structure, the warrior society, the healer society, all of those societies that exist still. At one time, they were very much, that's what grounded us. before contact. And so we're reconciling those, and it's going to take, it's going to take. You have to be patient, and it will come. And the more we work on it, the more we build on it. And also the Indigenous education, and bringing in our Indigenous knowledge, and into the classrooms, into the academic world, sharing who we are is so important, and that's our Cree culture, our traditional bundles, our Cree spirituality that is based on nature. All of these ceremonies, that's our side of our knowledge systems that exist. And so when we work with our knowledge systems, our Kihdeyak, our elders, we're training our young people to be the facilitators of these teachings, and also the learning about these ways right now. So we're talking about, the circular teachings, Nihioyun, the Cree teachings, the foresighted being of the looking after your emotional side, your spiritual side, your mental side, your body, your physical side. That's your whole being. And that to us is your holistic being. And so that to me, that is so important. To us, that's critical. And so those are the systems that you need to understand. So that's what we're working on, and reconciling and revitalizing, or reawakening, however you want to name it. And that also includes the right to birth at home, and that's very something that is we're working on right now, is revitalizing our birthing practices in our home community. And that's something that I had the privilege of welcoming my sixth grandson just back in March, in February 23rd. My daughter birthed her baby Kaleo in Sturgeon Lake, and with the help of a midwife and our birth support workers. And so that to me was was empowering, to have our medicines, to have our ceremonies, to have that fire there, to have that welcoming song, to welcome that baby into this world with our ways. And so that to me was very very grounding, and it just made me I came full circle with that, because I was born like that too, when I was born with my grandmother, who was tending my birth. And so it was very empowering to go through that. And so that to me is our birthright. Like, it's a natural process, and so that's what we're fighting for today. And when we say we're going back to our ways and utilizing our people. So our Kithieyak are the knowledge keepers. Our knowledge keepers are the holders of the teachings of what we should have been taught in a long time ago. Our people were taught about the stages of life, the child stage, the youth stage, the adult stage, and the elder stage, or the stage. And so those are the stages of life that we have to be mindful of when we're doing our programming, or when we're designing systems in our communities, that you have to make sure you have to plan for those future generations, and also that are coming. So we know that we go through the 4 seasons of change, and so those are also being taught as well. And the life cycles, like you said, and the 4 directions. So these are our own, I guess, I should say, our own science system, our traditional science systems that existed and are still exist, and they are very much are being reawakened everywhere that I looked at. It's really enlightening to see, inspiring to see more communities are going back to the way things were, and picking up that sweet grass, picking up the fire and water, and protecting the water, protecting fire, fire teachings. All of those are very instrumental of grounding us of who we are, and also grounding, balancing our holistic self of our being. And I talked about the four laws of change, how we're connected with the four elements. And those are some of the things that we are teaching everybody in our when we do traditional teachings in our community. We do breast measurement teachings as well. And we talk about the four races of men that exist in our community, that exist in today, and what roles and responsibilities do we have in making sure that humanity has a role. And I know that we've been told that our people, the Red Nations, are the keepers of the Mother Earth. They're the ones that look after her, and so that very much that my life has been grounded in learning about our ways, and and immersed in culture. I was immersed in Sundance ever since that I can remember. Connecting to a spirit and higher power has always been so instrumental for me. So that, to me, those are things that we utilize to do our imprinting of our people in our home community here, and bringing back that, and to be mindful that it's gonna, not to expect change to happen overnight, because look at how long change affected our being, our whole being. The communities were shifted, and so we have to be mindful to be patient, and to be and to continue with those rituals. And so that's why it's important to, to immerse yourself with your culture, the ceremonies, or the language, because it is through the ritual of our being, the ritual of understanding who we are, the ritual of taking, part in ceremony, taking part in the sweat lodge, taking part in Sundance, taking part in taking your medicine. This is part of who you are. You awaken your being, your whole being to that, and that's something that really is very important lesson that our elders talk about. And to me, it was not so much of being counseled all the time when I was growing up. It was seeing people in action, seeing my mom work with that hide, seeing my mom work with the water, working with the elements, with the medicines, helping people heal, and being part of the facilitating the healing. Because one thing that we can do, like I said, is it's not us that does the healing. It's the our creator, our Simantu. And so when we talk to our people, when we're working with our people in our traditional healing clinics, we do a lot of the counseling and reminding them that it is up to them, that that can affect change, that can heal themselves. It's between them and creator. And we are the conduits, we are the facilitators of change. And that's who we are as workers in our community. We don't work for a two-legged, we actually work for a creator. And so those are some of those very important messages that we rely on. And so we're just a portion, we're just a tiny bit of the solution, and when we're affecting change. So anything that we do it for our future generation. And one of the things that also when we impact change in an individual, we look at their whole being, but we also, behind that individual, there is a family there that we also have to look after. And the family is that is also needs to be included when we're doing our planning. And so when I'm talking to you right now is the systems level of the wellness system level. And one of the biggest changes or challenges of the Western model is they function from top-bottom approach. Whereas when we say the traditional approach is from bottom up. So we want to affect change on that individual, the individual's well-being, how well they're balanced with their spiritual side, how well are they tending to their spirit, and how can we help them. So how do we, impact that change? And that's something that we're we can do that by providing opportunities of access to a traditional healer, access to traditional healing through sweat lot ceremony, or access to a sweat Sundance, or impacting all those ways where they can connect to their high being, to connect to the higher power, and like everything in life, to tell those teachings that as our people, and they do listen when it's coming from an elder, people that have lived experience, that walk with those teachings, that live those teachings, that respect you, and it doesn't come with cost. Our teachings, is free, and that's something that Creator has given us, like life. Everything that Creator has given us is here for us. The medicines are here, the water's here to heal us, and the sun is here to heal us. And so everything, all the elements that are here, that are, that exist, they're here to support us. So we design our programs to meet the holistic needs of the individual. And then we also create opportunities to, provide that opportunity for the families. And we're working together. I'm always doing so those value systems of helping one another. So impacting with the use of our traditional knowledge systems is what's going to affect change, and advocating for those, our ways to be respected is of foremost important, very important for us to do that. And that's something that we want to give voice to the youth. We want to bring identity, the pride back, and to understand who you are as an Indigenous people. And I know that you're a strong Navajo nation, that you are very, when I had a privilege of visiting Arizona, and I see the richness of that culture still prevalent over there. And our people have resiliency, and that's one thing that that Western system is never going to take away of who you are. And your ancestral knowledge is you, and it's in your blood, and it's in your DNA. And our knowledge systems, we have a science system that is very powerful, and only and when we imparted with our how we live our life, and how you walk with your life, and know who you are. And so when you go back to your culture, that's what's going to ground you. That's what's going to speak for you. That's what's going to help you be strong, and be a strong man, be a strong woman. And also, when you take part in those ceremonies, when you take part in those rites of passages, when you take part of those naming ceremonies, when you take part of all those beautiful nation that your culture has, that's what's going to develop those strong roots. And that root is going to be deeply grounded, and you're not going to be swayed. And so that's something that you need to understand, because you know who you are. You know what your spirit is talking about when I talk about that. So that's just something that I wanted to impact. And so I feel passionate. I'm always for the people, and I know I advocate for our systems, and to understand where you come from. And that's the biggest part of healing too, is that you have to know where you come from. You have to know where your nation was, and that's part of healing, because you have to go tend to that part of when you're starting out on your healing journey, is we have to go and tend to those brokenness of ourselves, our woundedness of ourselves, and also our culture and to understand our people, to understand our community, where they've been. And residential school has been detrimental for our nations, has been very detrimental for our people's healing, has really stopped them on their tracks. And they have to be provided that opportunity to heal, and whether it's traditional by traditional means, so traditional cultural means, or else the Western. And you have to always be mindful to accept them for where they're at, and that's something that's been really important on this healing health field that I'm at, is creating that opportunities. So however the physical self is looked after, whether it's learning of how to look after yourself, your body, mind, and spirit, or whether they, creating opportunities. And for us, we fought for doctor services to come on reserve, because we saw the impacts of people that go to the cities and they're not getting the appropriate care. And so we fought for that service to come on reserve. And so they can be, so that they don't have to be fighting for that, because we know there's a lot of racial discrimination. There's a lot of stigmas out there, and neglect. And that's still very prevalent today about the systems outside our communities. We're always fighting, but we're fighting to create a system that is available in our community. So we have the two systems in our community where they have access to a pharmacist, they have access to a lab technician, a doctor, a podiatrist. So, and that's something that our people deserve. And that's something that we want to expand that, and other alternative therapies as well. We bring in Reiki, we bring in energy healing, all of that for them to achieve healing, and provide other opportunities, because there's other ways of healing. And also at the forefront is our nutritional healer, of course. And so that a sense of giving you a sense of connection as well with spirit. The meaning of Wahotun and all that is something that is very important as well. And talking about emotions too, one thing that I've learned, I mean, as you know, that you're going into your own great learning right now. When I started this journey, I had to do it for myself. I had to go through and experience everything from my teachers. I had to do my own great learning, and that means that a lot of the emotional healing that has to happen, a lot of the emotional grief and loss we went through to be where I am today. And so however I found myself is what, seems like the community's going through my own journey as well as I progress through the circle of life here. And so I am also a grandmother of 6, like I said. And so I have to get those teachings so I can also turn around and start sharing. And I'm at that sharing right now with my grandchildren, and learning about the concepts about spirituality and all of those our systems has been really great. So I just want to maybe just round off a little bit of the circle of cares that exist in our communities, where we've worked towards in mobilizing the community now. Because I just briefly talked about establishing those cultural grounding. It right now we're doing our best, because there's so much happening right now. And it's affecting our nations with the outside, and setting up your spiritual, your cultural, your I think it's the Prelegislation is what we're working with right now. So that's something that we wanted to establish, working on right now. So we can no longer ask the government so we can do our birthing at home or practice our ways. So that's the vehicle we're utilizing, is establishing your own legislation in the community. It's something. And education. So I'm really happy that there's young minds out there creating apps, creating new ways of, doing things, their arts and language. So all of that special stuff. So what a big change from 15 years ago to where we're at today. Like, I'm really glad that our people are being trained to be the effectors of change for next 7 generations. So, but I just wanted to just end there, I guess, and thank you for listening to me, and I wish you well in your journeys and your academic world, and hope that you will prosperity and all that. If there's any questions.
And thank you, Norma. That was, your sharing was absolutely wonderful. And I know a lot of people, we had a great turnout, 30 people. I know people got a lot out of your sharing. So thank you for that. And if you're able to stay on for a little while, I will ask if anybody has questions for you, if you're okay with that. And Norma, do you have an email if people have questions afterwards that they could contact you?
Yeah, I will just put it on chat, I guess.
Norma M at seskel.net. Well, I know for me, I have been a student of change theory for a long, long time. And I really appreciated you sharing the 4 main principles of change from a Cree perspective. Is that correct? And and I really appreciate that. I'm going to look for more information on that, so I appreciate that. Thank you.
The one that has really taught me lots about those 4 principles as well was Don Coyet's from Wellbeing, White Bison Wellbeing. And I've had the privilege of attending his fire starter training, and also the medicine wheel teachings, and also the Wellbeing. But I also have been enhanced with my Cree teachers. We're just going through our Cree creation story, learning about the language, the birthing bundles, the prenatal bundles, all of that. It's so rich. We have so much richness in our home community if you really look at it. Those elders are just waiting for us. And if you take the time with your tobacco, go seek it out.
Wonderful. Thank you. And we do have a question here from Sarah Twist. She asks, what has been your biggest challenge through overcoming a Western perspective of healthcare into a more Indigenous-based health and wellness model for the communities you've worked with?
I believe that the greatest challenge was getting them to understand from our point of view. They cannot understand it if they have not been immersed in it. So one of the things that we've always said is you need to understand. You need to go through the visiting exercise, the actually going through the exercise, even attending a SWAT, to actually be part of that. Because when you go to the SWAT, and there's an opportunity to learn what it is all about, the sweat loss, because it's a reenactment of the creation story where you're connected to everything of the beginning of creation, right? That's basically what it is. It's going back to that womb of being reborn. So having to really to make them understand that we have our own systems, and they cannot come and try and affect change and try and destroy it, because that's our livelihood. And so they need to respect that space. I guess that's for them to really understand that is the biggest challenge. Like for them to stop trying to come and control us when we have every right to, we have our own systems of being. And so, but they also need to understand a little bit of who we are. And so that's why that cultural competency training, cultural humility training is so vital at those institutes.
We had a couple of other people, thank you, saying it was a great session, and I couldn't agree more. So thank you, Norma, so much. I won't take any more of your time, and people have a way that they can contact you. And again, This has been recorded and it will be up on our YouTube channel. So if anyone wants to revisit it, or Norma, if you want to look at yourself talking for an hour and a half, it will be available for you as well.
All right.
So, all right. Thank you all very much, and have a great rest of your day.
Thank you. Thank you
All
guys.
right.
Take care.